Welcome to MedEvidence, where we help you navigate the truth behind medical research with unbiased, evidence-proven facts. Hosted by cardiologist and top medical researcher, Dr. Michael Koren.
Hello, I'm Dr. Michael Koren, the executive editor of MedEvidence. And I have a really neat opportunity today to speak with Lavern Dowell, who is an advanced registered nurse practitioner who's been practicing here in Jacksonville for a number of years and is really interested in research. So Lavern, tell us a little bit about yourself and then tell us why you're interested in research for your patients.
Well, it's very important that we have diversity in research. So my interest is because in the past, research was geared more to one side of the population. And today, my interest is that we are more diverse. For example, maybe a medication for high blood pressure. It's important to know that medication works for all type of people, not for only one side of our population.
Exactly. I think it's so important because you don't always know if something will work in men and women equally, in blacks and whites equally,
Correct.
People of different ages. And the only way to figure that out is getting everybody involved.
Correct.
And you're really interested in diabetes, so tell us a little bit about that.
So diabetes have been my passion for many, many, many years. I started looking into that when my mother-in-law was diagnosed with diabetes. And the first thing they told her that her A1C was elevated, and they brought her in to give her the result. And they told her that she was a diabetic. And just using that word really scared people. So as a provider, I went into diabetes because I wanted to deliver that message in a very careful and concise manner, not scaring people, because when you look at someone and you say you're diabetic, it can be thought of like a shame situation.
Right.
So as a provider, I don't want to shame people. I want to deliver a message, a chronic disease message, whether or not it's diabetes or lupus or any other chronic disease, in a manner that is sensitive towards that client.
Well, I think it's super important. Now, for treating diabetes, there's a lot of elements to it. There are lifestyle elements to it, and then there are medications. So how would you approach your patients to help them understand that both are important?
Well, first of all, every patient is individualized. We might have a patient with diabetes that weigh 400 pounds. We might have a patient with diabetes that weigh 125 pounds. So teaching them about nutrition is very important, but we have to know, is it for weight loss or is it for maintenance? Or maybe it's simple metformin will work for one patient, but it will not work for another patient. So that's very important, learning about your patient and their individual need.
So I have a question for you. I know that you take a very hands-on approach to your patients. So why don't you explain to folks what are the advantages to working with you and your concierge practice?
Correct. Thank you for asking that question. So I am a specialist in regard to diabetes, but also I do mental health. And I do believe that mental health plays a big, big role in taking care of yourself, whether or not nutritionally or whether or not taking your medication or even going to your doctor. At my practice, however, we don't treat one part of the client. We treat the whole entire client.
So important. Yeah, absolutely. Well, thank you so much for being part of MedEvidence. Best of luck with your practice, and we look forward to working with you in research.
Thank you very much.
Thanks for joining the MedEvidence podcast. To learn more, head over to medevidence.com or subscribe to our podcast on your favorite podcast platform.